Hello, thank you for joining this discussion about diabetes prevention and control. My name is Alexis Laprelle. I am a second-year health promotion graduate student. I am also an intern with the Lexington-Fayette County Health Department. The goal of this discussion is to address misinformation about diabetes by presenting the facts and providing guidance on the small steps that you can take to prevent diabetes. For individuals who do have diabetes, I will discuss the steps that you can take to control it and prevent long-term complications. So what is diabetes? Diabetes is a health condition in which the body does not make enough insulin, the insulin does not work properly, or a combination of both. Insulin is a hormone that transports glucose from the bloodstream to cells so that the cells can use it as energy. Diabetes is a health concern because it elevates the blood glucose levels to a dangerously high level, and that can cause tissue and organ damage. Throughout this discussion, I will use glucose and sugar interchangeably, as well as blood glucose and blood sugar. So how do you know if you have diabetes? Diabetes can be diagnosed through a blood test. You can contact your healthcare provider as far as testing goes. If you don't have a healthcare provider, or if you don't have a payer source for healthcare, you can contact your local health department. But for an individual with a fasting blood glucose level of 100 milligrams per deciliter or less, they're considered normal. For an individual who has a fasting blood glucose level of 126 milligrams per deciliter, they're considered diabetic. And for an individual who has a fasting blood glucose level of 100 milligrams per deciliter to 126 milligrams per deciliter, they are considered pre-diabetic. Their blood glucose levels are higher than normal, but they're not high enough to be considered diabetic. And this is a visual representation of someone who does not have diabetes. The red liquid is a representation of the liquid component of blood, and the beads, the white beads here, are a representation of red blood cells. So for an individual who does not have diabetes, you see that the red blood cells move relatively easily through the blood. They are able to easily transport themselves throughout the body. And for an individual who has diabetes, you will see that the blood cells are having difficulty moving through the blood. So they are slowly transporting themselves throughout the body. And it takes them a while. So there are different types of diabetes. There's type 1 diabetes, which is a juvenile onset diabetes. Type 1 diabetes is an autoimmune disorder in which the body attacks the pancreas, and it inhibits the pancreas' ability to produce insulin. Type 1 diabetes is primarily diagnosed in children, but there are also young adults who can be diagnosed with type 1 diabetes. Type 1 diabetes accounts for 5 to 10% of all diabetes. There's also type 2 diabetes, formerly known as adult onset diabetes. It's primarily diagnosed in adults, but there are a few cases where children are developing type 2 diabetes. Type 2 diabetes is preventable, and I will go through the strategies that you can take to try to prevent type 2 diabetes. And lastly, there's gestational diabetes, which is diabetes in pregnant women, and it goes away after delivery. Pregnant women are tested for gestational diabetes between their 24th and 28th week of pregnancy. Gestational diabetes is a concern because it can cause high birth weight in infants, which can lead to complications during delivery. An infant born at a high birth weight is also at a greater risk for childhood obesity and developing type 2 diabetes later on in life. And the same for the woman with gestational diabetes. She has a higher risk of developing type 2 diabetes later as well. So what does diabetes look like in the United States? So we know that over 30 million adults, 30 million Americans have diabetes. That is 1 in 4 adults. And we also know that over 84 million Americans have prediabetes, which is 1 in 3 adults. There has been a steadily increase in the prevalence of prediabetes and diabetes, and it's increasing at an alarming rate. Healthcare professionals and public health professionals are trying to educate patients on ways that they can reduce their risk for prediabetes and diabetes. And the best way for patients to understand diabetes is to understand the risk of developing diabetes. So some risk factors involved include being overweight, age, if you're over 45. Overweight includes having a BMI of 25 to 29.9, or if you're obese, it's a BMI of over 30. Being physically inactive, having an unhealthy diet, having prediabetes, high blood pressure, and also having polycystic ovarian syndrome. All these factors can increase your risk for diabetes. Also, genetics and being a racial or ethnic minority can also increase your risk for diabetes. There are also signs and symptoms associated with diabetes, which includes frequent thirst and hunger, or excessive thirst and hunger, frequent urination, sores that will not heal, or dry, itchy skin, or blurred vision. But there are also individuals who are diabetic that don't display symptoms, which is all the more reason to understand your risk and to be tested regularly if you are a high-risk individual. So how do you know how will you know to get tested? Some general guidelines that you can follow is if you're 45 or older, or if you're overweight with one or more risk factors, you want to go ahead and get tested for diabetes. If your test comes back normal, you can follow up every 3 years. If your test comes back pre-diabetic, or if you're still a high risk candidate for diabetes, then you want to follow up yearly. That is because, like I said, there are instances where you do not display symptoms. So having diabetes and not knowing it and having it uncontrolled can lead to complications such as heart attack and stroke, nerve damage, kidney and eye disease, complications during pregnancy, lower extremity amputations. All these things are complications related to diabetes. The best way to avoid these complications is through controlling it. So if you want to know the best way to control your diabetes, try to remember the ABCs. The ABCs include having an A1C level less than 7%, having your blood pressure controlled, which is less than 140 over 90, having a cholesterol level of 100 milligrams per deciliter or less, less than 100 milligrams per deciliter, and also through self-management education and stop smoking. All of these also improve your health overall and reduce the risk for heart disease and stroke. And also, if you do have diabetes, you want to learn how to manage it, which includes eating healthy, being physically active, taking your diabetes medication as recommended, checking your blood glucose levels regularly, and adopting healthy coping skills. And you can also gain insight and guidance on how to accomplish these tasks through the Diabetes Self-Management Education and Support Program. And if you go to the Kentucky resource, Kentucky Diabetes Resource Directory, you can Google it, or you can follow this link. There's more guidance and resources on diabetes that you can follow. And if you are pre-diabetic, you can also join a diabetes prevention program. They will also give you guidance on how to prevent diabetes, or how to go from pre-diabetic to not being pre-diabetic at all. So there are ways to prevent diabetes. One way is through a healthy diet, or healthy eating habits. You can follow the MyPlate guidance as far as how to eat a well-balanced diet. You want half your plate to be at least fruits and vegetables. You want to consume more whole grains, and you want to reduce your sugar and fat intake. You also want to consume more non-starchy vegetables. It's also best to consume more water and less sugary drinks. And you overall want to control your portion sizes and eat your meals regularly. And another way you can prevent diabetes is through physical activity or getting exercise. You want to engage in at least 30 minutes for 5 days a week. If you're not able to exercise the full 30 minutes, you can do it at your own pace or ease your way into it. Always consult with your healthcare provider before you engage in physical activity or have a change in your physical activity regimen. Doing tasks such as walking, jogging, running, swimming, hiking, or biking, all of these activities can improve your physical activity level. And lastly, you can prevent diabetes through losing weight. If you are overweight, you want to aim towards losing 5 to 7% of your body weight. This can be done through eating healthy and exercising regularly. And just note that normal weight loss looks like 1 to 2 pounds per week is a normal range for weight loss. So with all this information that I presented, now is the time to take action to prevent and control diabetes. We are in an epidemic of high diabetes and prediabetes nationwide, and particularly within the state of Kentucky. If you take all the steps in the guidance that I provided, you will be able to hopefully change your take charge and change lifestyle behaviors so that you can improve quality of life and prevent diseases such as diabetes. Thank you for joining this discussion. I hope you have a wonderful day.